urbanization has been changing the world at a pace and scale we've never seen. In developing nations, its effects have become more challenging than ever, outpacing access to basic sanitation and hygiene services, especially in poor communities. The United Nations' sixth Sustainable Development Goal is to achieve universal access to safe water supply and sanitation by 2030. Fast forward to 2030. The world's population has dramatically increased by 60.4%. 10 million people have populated 43 megacities, its city centers, slums, smaller settlements, and peripheries, exacerbating the global sanitation crisis. And time is not on our side. We have to start to think differently today. We need fresh, dynamic, unconventional ways to provide equitable and sustainable sanitation services that leave no one behind. We need new strategies to overtake the urban sanitation challenges of tomorrow. Despite considerable investments, city sanitation services still trail behind. This goes to prove infrastructure is not everything.
Sanitation infrastructure will only be as effective and sustainable as the mandates, capacity, and accountability of the institutions responsible. However, this requires regulations to be enforced, a clear communication strategy and effective ongoing community awareness raising, and a clear policy tariff.
Citywide Inclusive Sanitation, or Citywide, builds on existing sanitation good practices and reframes them with solutions that address diverse realities in developing cities. And as adopting it involves many stakeholders, there is a myriad of questions that seek smart yet practical answers. Who must be held accountable for sanitation service delivery? And what exactly are their roles and responsibilities in the sector? How can their performances be measured? What institutional arrangements are needed to sustain efficiency? How can all these come together to effectively implement ways to reach the poor? As a response, Citywide provides a framework that aims to resolve two crucial issues, among others: the lack of accountability mechanisms for services and the existence of weak institutional arrangements and sanitation authority mandates. Malaysia is a prime example of how these can be tackled. A highly urbanized country in Southeast Asia, its population has increased 5 times in over 60 years. Despite this, Malaysia has managed to connect around 70% of its population to proper sewerage services. Key to this achievement is its clear set of objectives.
We are looking at from the angle of the starting point, which is protecting public health, protecting water resources, and protecting environment. So current stages, you can see that has changed based on this shift in the objective of sewerage management from the most rudimentary scope to the one that we really desire it for. Even the policy makers, which is at the ministry level, have changed according to the objective of the sewerage management that we are trying to attain.
Control, regulation, capital and operational funding, and services have adapted with the changing needs of the times, while affordability has remained unchanged. This despite the increasing operational expenses brought about by modernization.
The tariff structure has not been changed in 1994. They are continuously subsidizing the tariff to date to the range of about 150 million a year right now.
Ensuring Malaysia's institutional arrangement and accountability mechanism for water and sewerage services is SPAN, its National Water Services Commission, which works autonomously, yet synergistically with authorities and private developers to regulate sanitation services and pricing.
The products used must be registered with SPAN. So the quality and the technology is being regulated. So the provision of toilets, sewerage needs, and the requirement had been pre-established and need to be complied with. So there is no issue that differentiating septic tanks for poor or connected services for rich. Any development exceeding 150 population must be connected. Any development lesser than 150 population can allow to use septic tanks. For dislodging services and fecal sludge treatment, there is a requirement for permit and license. Permit is for those who provide maintenance services or dislodging services. License is for those who provide operational services. The tariff is being regulated for the services and it is evaluated by span. So it doesn't matter whether you are in urban, rural, or whether you are in a different state, the prices are based on the regulation.
For on-site sanitation facilities, SPAN regulates the standards of the design requirements.
Any complaints from the consumer in relation to pricing or quality, they can complain to SPAN, and Water Forum has been specifically designated to look at whether the operators are complying to the level that consumers are expecting.
As Malaysia trails ahead in achieving its sanitation targets, we see how its strong institutional and accountability framework contribute to the achievement of the broader Citywide and SDG agendas.
There need to be linkages between what is the aspired service agenda for a city, a state, or a country, and then linking it to the relevant SDG 6 to establish the goals and targets. And from there, need to identify the action plans that need to be put in place to achieve that goals and targets.
Aligning outcomes with clear objectives while having a more coordinated approach from the accountability perspective is keeping Malaysia on track in providing the much-needed services to its ever-growing cities.
In the situation where the enforcer and enforced are the same entity, very clear definition of role must be identified. It is critical to understand the landscape of the entire chain. Understanding the context of each of that component along the chain requires us to establish who is responsible and how that responsibility is being assigned, who sets the policies and the outcome, who set the goals and targets, and how does that link to the city level. What is the most important component that you want to achieve? That will determine your goals and the target.
There may be a long way to go and many challenges ahead, but Malaysia undoubtedly shines as a beacon of good practices in the region. Zambia, a country at the crossroads of southern and eastern Africa, of the old and the new. With the growth of industries and expanding cities, rural-urban migration demanded for more thorough and unconventional sanitation approaches.
Zambia really moved ahead by investing. Their regulator changed their utilities mandate to begin investing in non-sewerage sanitation. And you can see them working through together, the regulator and the utility. We've invested in SOS, which is the regional regulatory association. And NOASCO and Lusaka are working now with 11 other regulators in the region to have a conversation.
Translating accountability to productive partnerships has been the cornerstone of good practices, effective governance, and meaningful outcomes for a developing country like Zambia.
There are some common threads across all sanitation markets that need to be reinforced over and over and over again, irrespective of the institutional context. That a lot of low and middle income countries, they haven't even formalized their sanitation service sector yet. And how can development partners think about supporting accountability systems in that really nascent phase? Thinking about accountability systems as partnerships with service authorities. And I think the sanitation authorities are also really trying to figure out how are they going to serve non-sewerage sanitation customers. They actually need a partner that is going to set targets and hold them accountable to targets.
In the face of its growing urban population, Zambia was able to achieve inclusive sanitation with enabling partnerships and effective regulation. Baguio City, the summer capital of the Philippines, and the only highly urbanized city in the mountain province. Being a popular tourist destination, its inhabitants of 350,000 can double in a day, posing challenges not just to infrastructure, but to management.
The city heavily depends on on-site sanitation systems. They have adequate legislation and available guidelines. Nevertheless, there is a complex institutional arrangement, which means that sanitation services are often not delivered effectively and safely.
To address this, the Asian Development Bank has provided soft interventions to help build capacity for asset management in operations and maintenance of the city's sanitation system, along with support in finance and communication.
Infrastructure alone won't deliver services, but institutions deliver services using infrastructure as a tool. And all those soft interventions are definitely necessary to make the project a success.
ADBI's Baguio project underscores that capacity building does not only mean investing in hard infrastructure, but also in soft infrastructure. Prioritizing both is a big step towards closing the gap in sanitation service delivery. The World Bank, through its Policies, Institutions, and Regulations, or PIR Incentives Initiative, is another institution that's trying to understand interplaying factors to promote safely managed and inclusive sanitation.
Weak in financial and institutional capacity of many service providers and governments, overlapping and unclear roles and responsibilities of different agencies, coordination, unrealistic policies, reforms, and financing strategy. This idea of the cookie-cutter approaches, if it works here, it's going to work everywhere.
The PIR framework harnesses World Bank's experience in addressing practical problems policymakers face in designing institutional components, improving performance, building human resource capacity, increasing transparency and accountability, and recognizing challenges of inconsistency between policies and implementation in different parts of the world.
The idea that no one size fits all. Each country is different, and you need to understand the political economic context. A holistic approach is needed. Reform is not an event or a linear process. Its success relies a lot on incorporating a high degree of learning.
Driving reform requires a perspective of sanitation within the context of a country and its institutions. The knowledge we gain from this will ultimately contribute to positive outcomes. As countries and cities continuously grow, we too have to continuously build our strengths by encouraging specialists, development partners, and decision makers to engage in conversations and deliberate on the complex issues surrounding accountability mechanisms and institutional arrangements within the Citywide's framework.
When we talk about citywide inclusive sanitation, I think looking from the perspective of many countries, there is no monitoring institution or lack of monitoring of what is actually constructed or installed. We need to first have a good understanding and to be able to make informed policies, to improve the situation of sanitation in the region.
What is the problem and why you want to have a regulatory agency? That is the first part of it. Second part of it is extensive consultation across the whatever level governments the country has. And the third part of it is need to identify all the agencies are set up within the country context at whatever government level, and then identify what are the potential scope that need to be sit under that regulator and put it up.
Achieving CWIS is not an easy task. It has to be a holistic approach. Every stakeholder needs to be partnered with it, and everybody has to be participatory. We are thinking outside the box. If we don't do it, there is no way we can achieve CWIS because of the nature of the problem.
We are seeing this shift already in urban planning. And I think, again, demystifying CVs, not making CVs as something that only consultants or NGOs or peripheral people speak, making it as exotic, as easy to do, mainstreaming it. How do we do that together? Data systems, yes, pulling our effort together for data, for having really easy access to data will help a lot.
When we do policy level things like discussions with our partners, we tend to bring our school of thought. There are so many cookie cutters. We have to avoid bringing in so many schools of thought. We cannot overflow our partners with different cookie cutters. We have to decide on one cookie cutter and reform that cookie cutter to meet the realities in the field and make it really operational.
To gain momentum in fulfilling the mission for universal sanitation, we have to look at sanitation services with fresh eyes, identify what's been holding us back and what will drive us forward. This is how we can accelerate progress through Citywide.
We have to really understand the local context. So we need to have a clear understanding of the characteristics of each country, about the challenges, about the bottlenecks, so that we can provide clear and specific support to the local situation.
Institutional change takes a long time, but sometimes it can be accelerated, and the positions that we're all in allow us to support conversations that help governments once they've decided to set goals for themselves.
2030 is a not-so-distant future. As cities of the world progress, how do we advance in achieving the goals towards a healthier, safer, more livable future? How can we not only close the gap, but achieve milestones towards sustainable sanitation service that benefits all? We have to get out of the box. And we have to reimagine, rethink, and reinvent.